Think of physiotherapy, we probably think of a physio and their patient in a room together, obviously. But when that's not possible, what do? Well, our man Kusal Goonewardena is the director of Elite Academy Sports Medicine, and he joins us now. Kusal, welcome back to Ticker Newsroom. How are you?
Good. Thanks, mate. How are you?
Yeah, really well. We had you on Ticker Sport, of course, a few weeks back with myself and David Davutovic. How's life been over the past month or so?
Well, it's been difficult to say the least. I mean, the university is still shut, and the majority of our students they haven't been able to get all the studies done properly, I guess. But we're just working our way through it, and just time will tell. But at least Australia, we're in a better position than some of the other countries. Like USA, UK, and Europe. So I think we can consider ourselves very lucky.
Yeah, and I think that's something we need to keep in mind. Obviously, no one expected it to come back a second time, but we've got to try and remain optimistic. Take our time, as you say. Hey, you're doing some really interesting things, so let's get into that. First of all, how has COVID-19 impacted patient care? Because, as I mentioned, one-on-one, usually we'd be there together. Can't do that now. How has that impact played out?
So, in terms of physio, at the clinic itself, because of the university being shut, people cannot come and get the care that they require. At the same time, because of the issues with the physical distancing, people are more worried. People are more concerned, and rightly so. So, in terms of what we're doing, we're trying to alleviate fear by making sure everything is up to standard in terms of, how things are cleaned and how things are maintained. That's very important. But also in terms of what the future will hold for us. So when we look at things like the movement patterns, how a person moves, pain levels, some of these things can be looked at remotely, and that remote function then comes down to, the use of technology, which is use of the sensor technology, and that's one of the projects that we're doing right now with the University of Melbourne, and with this sensor technology, we can now detect things like muscle fatigue, and with what's happening around Australia right now, there's a huge population that is working from home. Mm-hmm. And, when you think about all the companies that spent millions of dollars in ergonomics and the proper sitting and the chairs and the desks, and all of a sudden, in a matter of weeks, people are now working from home. So this could be potentially a problem that could arise for a lot of us, and as physiotherapists, we're looking to see how we can prevent any problems happening in the future. And this sensor technology will definitely come into play then.
So how has it impacted therapists? Furthering their knowledge and attaining qualifications? Is that something that's been more of a focus?
So in physiotherapy, I classify it as the 3 C's. There's communication. A good physiotherapist should have good communication, good clinical skills, and good clinical reasoning. Now, there are some things that can be taught through the channels of theory, but there's some things that need the practical aspect. And the fact that I can place my hand on someone, feel a muscle, feel a joint, those kinds of things happen through practice over and over, and that's through when our students are actually studying through placements. Now, one of the other things that we're looking at is creating virtual reality to get this done. So I've got students in China, Malaysia, Sri Lanka, who can then see everything that I'm seeing, potentially feel what I'm feeling, all done through virtual reality. So it's quite an exciting time that due to this isolation and due to this restriction that we have, we've come up with potentially 2 key things. One is the sensor technology to monitor our athletes and clients remotely, but also that our students can learn from a remote setting.
Yeah, it's good to know that even in these conditions, there's still more learning to be done, and that isn't prevented. At least we can do that. Let's talk about the sensor technology specifically. So why will this new sensor technology, VR and AR, why will it work?
So first, with the sensor technology, if I look at a typical day is me potentially exercising outdoors, but then working from my desk as well. And it is these times where I'm working from my desk that I need to know that I'm sitting properly, or I am reminded that I have been sitting long. We know that the human body is 70% water, so we're required to move regularly. And this sensor technology, what it does, it picks up muscle activity, and therefore it'll give us a lot of information on whether that muscle's fatiguing or not. And what we are finding is that sedentary postures create a higher chance of muscle fatigue. So if that's the case, we're looking at preventing something from occurring, um, before it becomes a problem. And the beauty of this is it's a smart sensor. So the sensor itself is the size, and it can be applied to you on a bandaid. So it's very thin, very comfortable, and being a smart sensor, it will send a message to your phone. So we have an app, and say, Kusal, it's time to move. It's time, you've been spending more than 15 minutes in a bad position. So, here are some exercises you can do to prevent it.
Let's talk about how this can have an impact on the global population. What are you sort of seeing? Is it something you're seeing at the moment, or is it more an expectation of what it can do in the future?
In my line of work over the years, I've been a physio for over 20 years, and about 90% of these cases, or 90% of the people I've treated, there's been some component that's been affected by posture, lifestyle. Not the 4 to 8 hours of sport per day potentially if you're playing that much or competing that much, but it's the other 8 hours that people do in a regular setting. And it's a huge population that we're seeing that we can assist. In Australia alone, there's about 4 million cases a year of musculoskeletal injuries, and that's Australia alone. In Australia alone, it actually costs about 35 billion in productivity due to these sedentary types of issues that then ultimately lead to injury. So we're seeing this to help not just Australia, but a global population. And I guess the other exciting thing is the sensor technology is so small, it's going to be so accessible, and it's going to be biodegradable. So, we're looking out for the environment as well. And it'll potentially change a lot of people's lifestyle and habits. So it's kind of like having Kusal in your back pocket all the time, saying, you've got to be doing the right thing.
Yeah, I guess, in a way, that's a good thing, I suppose. Just finally, do you think, because this is fascinating what you're talking about, clearly it can aid the health of populations around the world. Do you think this is something that the day-to-day kind of person knows about and understands, or do we need to, educate more? Is this something that you see people being aware of, or can we do a little bit more in that sort of space?
I think education is critical, but then the thing I like that we're doing, we're combining a product with the education component to it. So as people utilize it, people are learning. And this is something else that I'm noticing that a lot of good medical products are doing right now, that there is a component of education coming in with the product as well. So when you increase awareness, increase education, the likelihood of success is a lot higher. And I think that's also in terms of what we're doing, even with the training of physiotherapists overseas, that they understand why we're doing this, and that makes for better outcomes.
Awesome, mate. Thank you so much for your time. Tell us how we can get online and just keep in contact with you if we want to find out more about what you're doing. What's the best way?
Best way would be to jump on our website, so www.eliteacademy.com, and anyone can jump on. Please connect with us, and we're more than happy to share what we're doing and how we're trying to take our Australian expertise overseas.
Great, Kusal, really good to see you. Let's touch base again down the track and you can give us another update. Enjoy the rest of your day.
Thank you. Talk to you soon.
Great stuff. Kusal Goonewardena there from Elite Academy Sports Medicine. So jump online, LinkedIn, Facebook, and check it out. He's really doing some remarkable things. Okay.